Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Dr. Graham Taylor. My guest today is Heather Sandison. Heather is a naturopathic doctor renowned for her groundbreaking work in dementia care. As a primary clinical investigator and author of a peer-reviewed article published in the Journal of Alzheimer's Disease, she has demonstrated her commitment to advancing the understanding and treatment of cognitive decline. Heather is a founder of Marama and Solcere Health Clinic, pioneering facilities focused on optimizing cognitive function and reversing dementia. Additionally, she hosts the annual Reverse Alzheimer Summit and is set to publish her book, Reversing Alzheimer's, aiming to empower individuals to maintain sharp brain health at any age. We're excited to have Heather with us today to discuss brain health protection and her new toolkit to reversing Alzheimer's disease. Well, Heather, welcome to our show today. So nice to have you here.
Thank you. It's a privilege.
Thank you. Heather, some doctor's visits can be more challenging than others. And, when a patient and their loved ones hear a physician give them a diagnosis of dementia or Alzheimer's, it is truly a difficult and challenging moment with a sense of powerlessness and oftentimes feelings of hopelessness in that moment. That can be all encompassing. As we start today, I would love for you, if you would, to give our listeners kind of a 2-minute education on this whole disease process so we can get some clarity in the definitions and terms we're going to be using. Would you do that for us, please?
Sure. Many people ask what the difference between dementia and Alzheimer's is. And dementia is an umbrella term that includes Alzheimer's, but also includes frontotemporal dementia, vascular dementia, Lewy body dementia, posterior cortical atrophy, and others. And one thing that's confusing about this is, although we want to understand the diagnosis, what it's called, what the pathophysiological process is, from my perspective, and a lot of what I'm going to share today, I'm not too worried about what we call it. I'm more concerned about why it has happened. And we often will see that there will be overlap. There will be a lot of kind of gray area between a Lewy body case and an Alzheimer's case, and even a Parkinson's case or other neurodegenerative diseases. And so, again, that focus on the diagnosis for me is less important than on the why. What are the causal level factors that brought us there? And so I think a lot of the conventional conversations around Alzheimer's really are centered on the beta amyloid plaque hypothesis, that someone arrives at an Alzheimer's diagnosis because of misfolded proteins in their brain. And yet I'm going to challenge you to kind of rethink this. I think of the brain as a complex system. And certainly, I think we can all agree that the brain and the body are complex systems. And like a house plant, what I've got behind me here. Also, potentially, you could think of this as a complex system. And if it was wilting and dying, we wouldn't ask the question, is it misfolded proteins causing this problem? We would think through, is it not getting enough water? Does it not have enough sunlight? Is it being poisoned by something? We would ask these questions about what makes a living thing thrive. And then we would try to optimize for that. And I want to propose that we do the same thing for Alzheimer's. We've come to a point where baby boomers are aging. Alzheimer's has become an epidemic. There are many, many more people. There are, I think, 10,000 people a day in the US turning 65. And as we age, that's our highest risk factor for developing Alzheimer's or other dementias. And yet we do not have a pharmaceutical intervention that provides much hope at all. The only thing that we can do with pharmaceuticals right now is delay the rate of decline. So we're essentially drawing out a torturous process. And I think that the reason why we don't have a pharmaceutical intervention that provides hope or any sort of therapeutic benefit is because we haven't had a solution that matches the complexity of the disease process. And so that's what I would invite us to kind of talk through and think through today.
What a great start. I would love to kind of just dovetail off of that into rethinking the why of its cause. So how do you think about it?
Yeah, so I apply sort of a complex system science approach. And when we think of any complex system, whether it's a government system or a financial system or a medical, of course, or educational, Balance is really crucial to function in a complex system, this homeodynamic state where things are changing, but we need to maintain some sort of balance, right? If we have imbalance, too much, too little, in the wrong place, at the wrong time, we start to get dysregulation. And in this case of the brain, we get disease, a disease
Hmm.
process.
Yeah.
And so I would argue that there's essentially 6 factors at a primary level that when they are out of balance and we can systematically go through these, we can achieve better outcomes at a cellular level in the brain. And those 6 things that we can talk through are toxins, nutrients, stressors, structure, infections, and then signaling. So
Really
again,
good. Hey, yeah, let's walk us down through some of these. I mean, we're talking about the causative components here, and maybe these are some of the things that we can get out in front of in a primary prevention way or secondary prevention way. I would love you to walk us down through those. Would you please?
absolutely. Yeah. So my mentor, Dr. Dale Bredesen, he wrote the New York Times bestselling book, The End of Alzheimer's. And he calls this approach a cognoscopy, if you will. So, right, we're
I
supposed
like
to
it.
we're supposed to look
Good.
for colon cancer, catch that early, and stop it by getting a colonoscopy, right? So if we do a similar sort of thing that's a little more comfortable than colonoscopy, but we look systematically at the causal level factors,
Mhm.
we can do testing. We can do a lot of testing and we can evaluate our lifestyle going back to these primary causes. So toxins, I think of these in 3 flavors. They're heavy metals, chemical toxins, and then biotoxins. I know we were discussing how you live in Hawaii and hot fish, right? Ciguatera is a type of biotoxin. That's a little bit esoteric. Much more common is mold toxicity that people can be exposed to in water damaged buildings, sick building
Mm.
syndrome. Those things can create inflammation in the brain at a primary level that can drive these misfolded proteins. So that's toxins, nutrients. You'll sometimes hear Alzheimer's called type 3 diabetes. And this is when
Yes.
sugar becomes toxic and literally
Mm.
leads to the caramelization of cells. And so getting enough nutrients, but not too much. Again, it's this balance, the right amounts in the right place at the right time. Functionally, we need enough B12 to get our red blood cells to divide, to detoxify, to run lots of processes in the body. And some people, that functional level is different from another individual. So we can measure for that. We can think of gross deficiencies like not enough vitamin C. Pirates and people many years ago would have scurvy and their teeth would fall
Yes.
out. And then there's this functional nutritional deficiency where we don't have enough to run our cellular processes efficiently. And we see that with the food system that sometimes our foods are nutrient deplete, particularly if we consume a lot of processed foods or processed carbohydrates in particular. So we recommend an organic ketogenic diet for those who want to take on a very brain healthy diet and kind of alternating with either plant-based or paleo diet, going back and forth in and out of ketosis and using that metabolic flexibility
Mm.
to optimize the resource production and energy production in the brain. Yeah, so toxins and nutrients and then stressors.
Mhm.
As we approach retirement, many people, I think, are well deserve a vacation, to regroup and to relax and to enjoy kind of the fruits of their labors later in life. And yet, if that looks like kicking your feet up, watching TV, and not getting any exercise, that you're in a use it or lose it kind of situation. So we want to be motivated. We want to have purpose and meaning, even in those retirement years. We want to exercise. So we want enough stress, but we don't want so much stress that the cortisol, the stress hormones become toxic.
Mhm.
We see in this community around dementia and Alzheimer's, care partners, caregivers for someone with dementia are anywhere from 2.5 to 6 times more likely to develop Alzheimer's in their lifetime than people who never serve as a caregiver.
Wow.
The
Wow.
stress and burden of caregiving is very real, it's measurable. And this can be from sleep deprivation, from the grief, the long goodbye that is
Mhm.
Alzheimer's. It can be from the financial burdens and the physical burdens. Many people who are caregivers, they're not putting their exercise and diet habits first. So we aim to partner with people and make sure that if you're listening to this as a care partner, that it's not just about the person you're caring for, that we're also making sure that you don't become the patient later on by managing those stressors. From a structural perspective, so again, we've talked about toxins, nutrients, stressors, and then from a structural perspective, things like a traumatic brain injury, right? If you get hit over the head with a baseball bat, or football players who have CTE as a form of dementia, the inflammation that's caused from a traumatic brain injury can put us at risk for developing dementia. But so can molecular predisposition. So this would be genetic precursors or a genetic predisposition. And the ApoE genetics are ones that are interesting to look at. And although these are not, it doesn't mean that you're definitely going to get dementia if you're ApoE4 positive. But you get one from mom and one from dad. I'll just explain this quickly so that people have a little bit of an education around it. You get one copy from mom, one copy from dad, and those copies are going to be either a 2, a 3, or a 4. The general population, regardless of your ApoE status, has a 13% chance of being diagnosed with dementia. If you have one copy of a 4, either from mom or dad, then you have a 30% chance of developing dementia. If you have a 4 from mom and a 4 from dad, you have over 50% chance of developing dementia. And I encourage people to find this out early on because you're going to want to do your cognoscopy in your 30s rather than waiting until 50. You might have to work a little harder at prevention than your spouse or your neighbor. But knowing, I hope, is empowering. Another piece of structure that I want to make sure to mention here is obstructive sleep apnea. When you're not getting oxygen through your airway collapses at night when you're sleeping, and this creates hypoxia or a lack of oxygen going to the brain. And this is directly related to dementia. I've had a patient over the last year, and she's been such a pleasure to work with. Her family is phenomenal. Her 2 daughters, I tell them it's like watching a game of volleyball because her husband and her 2 daughters just like say, okay, I'll make the appointment. Can you take mom? I'll order that. Can you make sure she gets it every morning, Dad?
Awesome.
And they're laughing and they're enjoying each other. And their mom, I started seeing her about 18 months ago, and she had a MoCA score of 8. So a MoCA is the Montreal Cognitive Assessment Test. And it's a one-page worksheet that some of your listeners may have seen. You draw a clock and copy a cube and name the zoo animals and tell people where you are in time and space. And a perfect score is 30. So it's a one-page worksheet. There's essentially 30 points you can get. And she had a score of 8. So normal is 26 and above. And when we get into single-digit MoCAs, this means she's completely dependent on others for her day-to-day, basically activities of daily living, for cooking, dressing, potentially even going to the bathroom, right? So this is the difference between dignity and independence. When we get into these lower MoCA scores, as a provider, I have less confidence. It'd be harder to help someone like this. And we found out that she had obstructive sleep apnea along the way. And in the past year, she has doubled her MoCA score. And this holiday season, so she went from an 8 to a 15 now, and nearly doubled. And this past holiday season, some of the cousins had come to Christmas, and they were like, "Oh my gosh, your mom's back!" Like,
holy cow!
It really. I mean, I was in tears. I think a lot of providers who do this work, we end up in tears all the time of just like joy, fulfillment that people get another holiday season together. And the biggest thing for her, I really think, was treating her sleep apnea, getting her oxygen to her brain at night so that she could be rested. She could rinse the toxins through that lymphatic system at night. So a really big piece. And I hope that any of your listeners today, if you have any inkling that you might have a sleep disorder, if you are not waking up feeling rested, if there's any suspicion, or if you hear your partner gasping, of course, although I will say she's a thin female. She does not have and nobody thought she snored. So she wasn't a classic sleep apnea patient. And now at this stage, anyone with cognitive decline, I have them scheduled for a sleep study because it's one of those things you really, really don't want to miss and can make a huge difference in cognitive function, even in later stage Alzheimer's and dementia.
Very good. So we got 5 of the 6, I think, so far. What's the last one?
So I think that we have 4 of the.
We have 4 so far? Okay, 2 more.
I'll be quick. Infections.
No
Infections are another one. COVID has been an infection that's created inflammation in the brain. Many people have experienced the brain fog post-COVID. P. gingivalis, associated with dental infections, and gingivitis is another one directly associated with inflammation in the brain, as is the herpes simplex virus
Mhm.
and also the Lyme spirochetes. So there are some infections that we know are directly related to generating inflammation in the brain and even triggering the production of beta amyloid plaques, which we have found are antimicrobial. They're actually there to protect us.
Mhm.
And so knowing that they're there means there's something they're fighting, and identifying that potential infection and then eliminating it can stop that triggering effect to create that defense. And then the last component is signaling, is the signals that come from our organs, from our endocrine organs, including our muscle, can send hormones like testosterone, brain-derived neurotrophic factor, thyroid hormone. Our brain has receptors for all of these signaling molecules, and we want to maintain robust signaling molecules as we age because they help to support neurogenesis and synaptogenesis. So, looking systematically at our hormones and signaling systems as we age is another way to help prevent and also reverse dementia.
As you go through these six, I'm thinking about the various ways that you assess and measure these causative factors. The MOCA, for example, or a sleep study. What are the kind of tests do you run to help folks kind of get some data and some kind of baseline measures here? What else do you do?
Yeah, so I'd love to put that in the show notes because it is
Yeah.
robust. We run about 14 different tests, and
Okay.
each of those tests has 30 or 40 markers. And so I'd love to get people, where they can see it. But
Right.
we run what your traditional provider, your conventional provider would do, but on steroids, right? We're looking into the advanced cardiometabolic markers, the HOMO-IR, and not just an A1C and a fasting glucose, but we're looking at fasting insulin. We're
Mhm.
looking at homocysteine, we're looking at inflammatory markers, we're looking at small density LDLs and LP little a, lipoprotein little a, LPPLA2. There's robust markers that, although we can run them through Quest and LabCorp, they're not always on a traditional panel. Thyroid, also, we run 8 or 10 markers for thyroid every time instead of 1 or 2. But then we look for the toxins that I described. We look at gut health. Are you digesting and absorbing? You may choose to eat really great foods, but then do you have the capacity and the ability to break them down, absorb, and assimilate them? And then we are looking for the infectious panel. And when we look at a MOCA, that's really the result, right? This is the manifestation. So although it helps us track change over time, we also look at a p-tau 217, which is a phosphorylated tau that's associated with Alzheimer's. That's actually a pretty new marker that we've just started looking at in the last 6 months. But these help us understand, are we oriented in the right direction, right?
Mhm.
Are the meaningful things cognition and your ability to show up in the world and have conversations and be in relationship and remember birthdays. That's what matters to people. And so that's what we're measuring to see if we're getting the right result or if we potentially need to change course. Do we need to dig a little deeper, find some other cause potentially?
We'll be right back after word from our sponsor.
Whether you're a longtime or first time listener to Behavioral Health Today, you're probably familiar with Triad, the company that brings you this podcast. But you may not know that Triad also hosts a community for current and aspiring behavioral and mental health professionals, featuring trending content and education and career resources, all for free. If you are a behavioral or mental health professional, or you're studying to become one, join more than 80,000 people on Triad by claiming your free professional account today. Visit us at hallotriad.com/BHT. That's hallotriad.com/BHT and join the Triad community today.
Those are really great. I love as you talk about the assessment processes here that you can go through. And you mentioned something about kind of just not oftentimes as a traditional approach, maybe take quite as a well-rounded approach as you're taking 14 different tests and other markers off of that. And we will definitely get that up on our show doc for folks to have access to. What does a naturopath do in terms of their assessment that might be unique to and very helpful in assessing some of the things you're describing today? What's unique about a naturopath's approach?
Yeah, thanks. So I'm trained as a naturopathic physician, and that means that philosophically, I'm looking for how do we achieve health? Not just
Yeah.
how do we get rid of the symptom, but
Yeah.
how do we really optimize for health and healing? That my role as a doctor comes from the Latin word docere, which means to teach, which is about having a dialogue with patients so that they can leave with more information and make better decisions about the things that really matter for their health, which is what they choose to put in their mouths each day, what time they choose to go to bed at night, how much movement they get throughout the day. Those are the things that really change the trajectory of health as we age. And
Mm.
that's the emphasis of much of our conversation as a naturopath versus as maybe a conventional doctor. I spend 90 minutes with my patients on their first and second visits. Many conventional providers, they're stuck in a system
Mhm.
where
Yeah.
that doesn't work. As much as
No.
they would love to do that,
Yeah.
they don't have that luxury. And
Yeah.
we kind of go outside of that system that, from my perspective and my experience, it doesn't always serve patients with a diagnosis of dementia to have these really quick visits that are
Mhm.
focused on more bite-sized chunks, but not looking at that whole.
Yeah.
So the naturopathic perspectives of find and treat the cause, uh, doctor as teacher, getting at really having these dialogues and learning to and understanding your patient, what works for them, right? Every patient comes to me with different constraints. Sometimes it's financial, sometimes it's time, sometimes they've had their driver's license taken away after seeing the neurologist. And so now they can't get where they need to go to get the exercise or to go do the grocery shopping. And so really taking the time to dive into understanding and knowing the patients, I think is another critical component. But it's not unique to naturopathic medicine. There are some really phenomenal functional medicine doctors who are doing this work. And again, my mentor, Dr. Dale Bredesen, trains providers anywhere from health coaches to medical doctors and neurologists. He has trained thousands of doctors around the world and health providers around the world to help get more people access to this type of care.
Really good. Yeah, I appreciate that. I think that's such a unique approach, and I love the well-rounded thoroughness and the comprehensive kind of picture you have of someone when time is taken, proper tests are given. Let's segue a little bit. Let's talk about your book. I would love for our listeners to hear about it and just your focus in it, what went into writing it, and what you'd love folks to learn about it here on our show.
Sure. Yeah. So when the opportunity came up, I think like many authors, I thought, "Okay, do I really have something unique to offer
Right.
here?" I struggled and did a lot of kind of spiritual digging to ask, like, what's unique? What can I provide here? And I think Dr. Bredesen, of course, has done a phenomenal job paving the way. And what I had to offer was my experience seeing so many patients doing research in my clinical practice where we showed that 74% of our patients with mild cognitive impairment got better after 6 months of intervention. And we published that in the Journal of Alzheimer's Disease. And then I also have had the unique experience of starting Marama, the resident
Yes.
care facility here in San Diego, where we offer an immersive experience in Dr. Bredesen's protocol. And really, this book, it doesn't feel like mine. It very much belongs to and is an account of the people I've had the privilege of helping and watching recover some of their memory and cognitive capacity, and also the people who love them and who have shown up for them and done the work to put this protocol into action.
Heather,
My
73%, that's a huge number.
73.9%. It was
Wow.
almost
Let's
75%.
just
Yeah.
round up. Yeah, that's phenomenal.
I was even surprised, and it came out of having the clinical experience of seeing people get better, and then
Right.
people calling and asking a very reasonable question. If I do this, if I spend the money, take
Right.
the time, put in the effort to do this for my mom or dad or spouse, what's the likelihood it's going to work?
Yeah, basically,
And
does the medicine work?
yeah.
Yeah, that's a great question. And so you get to say, yeah.
Yeah, it does, and it surprised me that it was that often because we took patients with MoCA scores of 12 to 23. So again, a
Okay.
perfect score is 30, a normal score is 26 and above. So everyone we included in the trial had measurable cognitive impairment, and some even had a diagnosis of Alzheimer's.
Mm.
And we saw that the majority of them improved.
Wow, that's significant. Well, can we talk a little bit about both your book and also what you're doing to help folks improve? We'd love to hear that.
Yeah, so the book, each of these kind of iterations of these offerings has come from people coming to us and saying, "Hey, I have this question. Where can I send my loved one who has
Mhm.
dementia? I've got a full-time job and a dog and kids and a life to manage, so I can't do
Right.
all of this for my mom or dad." And that's where Marama came from, the residential care facility. "Okay, we'll do it for you." And then what we heard once we created Marama was, I love this idea, but I live in Kansas or I live in
Mm.
Australia or the UK or Florida, and I want my mom close by. I don't want to send her to San Diego. And so out of that, we had the coaching program, and there was an overwhelming amount of interest in that, which was humbling and incredible. And I had the opportunity to provide that course to groups of coaching, like cohorts in a group model, and it created this wonderful community that was online, but it was great because I don't know how it happens, but we would get these clusters of people from Texas, and then these clusters of people from Canada, and then clusters of
That's
people from
awesome.
Maine, and they would meet up,
Oh,
and
really?
they would have accountability partners, and I swear there was even, like, a love. There
I
was
would imagine there could be
some
something
romantic.
going on.
Yes.
Absolutely.
So it's just been so fun to do those, and out of that, the book was kind of created. We got the opportunity to write the book, and so the goal is impact, is
Mm.
that fewer people suffer, that this disease causes so much suffering. And from my perspective, it's unnecessary. Much of it is unnecessary.
Mm.
And that there are lots and lots of people out there who, armed with the information and the tools to put this protocol, Dr. Bredeson's work, into action, they can avoid so much suffering. And my work is essentially to change the narrative so that more people have access to this information, they know that it exists. And then the book is very much informed by the coaching programs. And so what makes it doable? How do you
Yes.
create a doable plan? How do you put it into action?
Yeah, I love that goal. Let's control the controllables. If there's some things out there that we can actually do, let's control the controllables. You talk about if we can reduce unnecessary suffering with a protocol that clearly is working. Walk us through some of the factors of that. What's working?
Yeah, so going back to those causal level pieces, working with the provider to measure those so that you can get specific precision-based medicine, right? This is 21st century that we're like moving forward into the future of medicine. Now, outside of that, before you even see a doctor, spend time or look for one, there are foundational pieces to this. And sometimes they're the most challenging, but the most worthwhile. So,
Mm.
diet is crucial. And again, we recommend an organic ketogenic diet. I've got recipes in the book, and there are other great books out there that help with a ketogenic diet. But you want a healthy keto diet. This isn't the bacon and cheese diet, right? This is lots of veggies, but getting into ketosis where you restrict carbohydrates enough that you flip that metabolic switch. And your brain prefers ketones for fuel and you'll burn it more cleanly. You won't create as much
Mm.
oxidative damage with burning ketones for fuel versus glucose. And flipping that switch, we're like hybrid machines. And when we switch back and forth, we create more metabolic flexibility. Most Americans have only ever burned sugar or carbohydrates or glucose for fuel, but we can burn ketones. And we've had patients where they haven't known their grandchildren's names for a while, and they get into ketosis, and within 3 days, they
Seriously.
know their names again.
Seriously. Wow.
Yes,
Wow.
it's astounding. And even no matter where you are on the cognitive spectrum, I work with CEOs who are very high functioning, have no cognitive decline, but they're looking for that edge.
Yep.
And getting into ketosis can help. I personally get into ketosis a handful of times a year for 4 to 6 weeks and notice that I have better energy levels. I sleep better. I feel more articulate, and sharper. And so, putting that on your side, the dietary piece, avoiding no matter what you decide about ketosis, reducing your highly processed carbohydrates, packaged foods, getting that to a minimum is, I think, essential for reducing the risk of all chronic disease.
Agreed. Yeah.
Oh, it's just so, I mean, the food system,
It's
that's
getting and
for
it's
another
getting
lifetime.
worse, and it's getting
Yeah.
worse, in a very scary way, in a very governmentally controlled way that's to everybody's detriment, and it's, very, very concerning, but That's probably another show. Let's talk about what else you're doing that's working. What are some of the factors in that? What else?
Yeah, so exercise, movement, and I recommend a minimum of 200 minutes per week of moderate to vigorous exercise, and there's different ways to calculate that. But a trick I want to share that you might not have heard of other places is what we call dual task exercise. So it's where you're combining cognitive engagement at the same time as physical engagement. And we are partnered at Marama and at Solcere, my clinic, and generally partnered with the Pacific Neuroscience Institute, where Dr. Bredesen works, and my good friend Dr. David Merrill, Ryan Glatt. There's a team there, and they've published a lot of the research around these dual task exercises and how important they are for improving cognition. And so you can imagine that when there's many mechanisms that are at play here, and this has been used for traumatic brain injuries and strokes, and for other sort of brain degeneration in other contexts. But we encourage people to do this to optimize cognitive function, even without having had a stroke or a traumatic brain injury,
Mhm.
because we see the benefits. So the simplest thing here is walking and talking.
Yes.
Now, if you want to take that to another level, going to a class where there's an instructor that's cueing you, whether it's a Pilates, yoga, Zumba, aerobics, jazzercise, whatever it is, having that cueing requires you to stay cognitively engaged.
Yes, it does.
Now, there's some times when, if you've been going to the same yoga class for 10 years, you know exactly what the instructor is going to say before they've said it. That's no longer cognitively engaging.
Gotcha.
So you want to stay at that edge where you're between 70 and 80%. You're not running a marathon and breathless. You can stay cognitively engaged. You're not giving up. It's not so cognitively challenging or physically challenging that you give up and you're at 100%, but it's right there where you're not also checking out, right? So it's
Good.
not a relaxing stroll. It's a fast-paced walk while you're talking. For me, sometimes I'll listen to a podcast, maybe
I was
Peter
gonna ask.
or
Right.
or an Andrew Huberman, where it's really heady and really involved. But I force myself to pause it and then either think back through, or if I'm in a place where it's appropriate, I'll say out loud what I just learned,
Mm.
because that gets me more cognitively engaged. It's not just passive.
No. Very good. So we got diet, we got exercise. Give me another one.
Sleep,
Sleep.
sleep. So I talked about obstructive sleep apnea. But even many people don't realize that one night of sleep deprivation, whether you're in your 20s, 30s, 40s, well before the onset of any symptoms associated with dementia, just one night of sleep deprivation will lead to a measurable accumulation of beta amyloid.
Mm.
So you can imagine that over the course of decades, sleep deprivation is a significant contributor to dementia and Alzheimer's. At night, when we get deep sleep, our brain rinses out the amyloid, the toxins, other things that are accumulating. It gets rid of the waste. Then, if we deprive ourselves of that deep sleep, which most people get in the hours before midnight, if we deprive ourselves of that, we don't get that rinsing. We don't get that cleansing of the brain. And we're going to end up with dysfunction, right? Dysregulation. This is that imbalance. There's too much of the wrong stuff accumulating in the brain. So prioritizing sleep, rejecting that idea that we can sleep when we die. We need sleep every night.
Yeah. Really good. One more.
Stress management.
Awesome.
So Kirtan Kriya is a form of meditation that has an abundant amount of literature associated with it. There's review papers that describe the benefits. I mean, they're really incredible. I mean, if everybody would do 12 minutes a day of Kirtan Kriya, the world would be a different place.
Give us the name again of that meditation.
Kirtan Kriya.
Okay.
And I'll spell it for you because I want people to be able to look it up, and we can again add it to the show notes. But it's KIRTAN
Uh-huh.
KRIYA, and you've probably maybe come across it. It's the Satanama,
Oh yeah.
and there's these
Yeah.
hand movements where you put your thumb to each of your other fingers, and then you chant. And there's just really impressive science around what it does for your brain, for both caregivers and for people struggling with cognitive decline. It's only 12 minutes a day. You can be guided for free on YouTube whenever you want. And so there's no reason not to try it, right? I feel like this is one of those things that everybody can find 12 minutes a day.
Anybody can do anything for 12
Anyone.
minutes. That's right. That's so
And
good.
for some people, they want to they're already going to church on Sundays and they want to do more of a regular daily prayer practice. And that
Mm.
works. Maybe it's a gratitude journal. Maybe it's a different meditation. Whatever it means for you, having some sort of daily mindfulness practice where it's quiet and it something that helps you regulate your stress and your nervous system.
Yeah, really good. So Heather, these are things that we can do to get out in front of this in some ways. These are great preventative things, and like you said, these are controllable. Are these the things that you're doing in Marama with the
Yeah,
folks that are,
exactly.
is that right? So cool.
Yes.
Yeah.
Yeah. So at Marama, yeah, the day basically looks like in the mornings, we have care partners who help our residents get all of the supplements and medications that they need and
Yeah.
make sure that they're doing those correctly because that can be a lot to manage on the Bredesen protocol. And then our breakfast, lunch, dinner, and 2 snacks a day are organic and ketogenic. And you were
Yeah.
invited anytime to come have a
I
meal
was
with us.
gonna say, what a great place to work and kinda go visit, and
The
that's
food's
wonderful.
phenomenal. I always aim to show up when it's like mealtime so I can get some. Our chef Gil, he is just amazing, and it's beautiful and it's healthy. Of course, it's organic and ketogenic and fresh, and it
Yeah.
tastes so good. Nobody's missing anything. No one feels deprived. And after breakfast, they usually go for a walk anywhere from an hour to 2, and then they come back and do the meditation. They do kirtan kriya, and then they get into some creative activity. So for one person, that might mean writing their autobiography over a few
Mm.
months. For someone else, it might be working on a puzzle, some sort of cognitive engagement and creative engagement, and something that they enjoy. Having fun with these is really crucial. A lot of people will tell me, I don't want to do the brain games on the computer. I'm like, great, then don't
Do something
learn to
else.
play the ukulele or learn to, sing, do something that you do enjoy. Go to a class, a ceramics class, whatever it is that gets you fired up, do that.
Yeah.
And then we have the brain gym in the afternoons where it's more vigorous exercise. There's strength training. We'll do sauna therapy, red light therapies, other kind of biohacking, neurohacking therapies in the afternoon. And then dinner time, of course, we have our organic ketogenic meal, but after dinner, it's really easy to kind of veg out. And so what we do instead is we encourage and create an environment where it's fun to play games, the
Yes.
bananagrams or Uno or Scrabble or some other type of game so that there's more community engagement and we're not just zoning out in front of some stressful TV program.
What a wonderful day. What a wonderful life they get to live. I was recently watching a show recommended to me, maybe you've seen it, The Blue Zones,
Yeah.
on Netflix, and I just fell in love with this show. I think I can be one of their evangelists. I just was so impressed, and the people were so beautiful. Those that are, identified throughout the world, I think 6 different places that are centurions, close to or over 100. And the thing that was so striking to me was that they're not just people kept on life support, or just kind of moping around or they made it to 100. No, these were vibrant, engaged, with all the things you're talking about right now with exercise and play and movement and dance, food, the way they were living. One of the things that really struck me, they did one in Okinawa, and they were talking about how Okinawa, with one of the blue zones, also has now a younger population that has the highest obesity rate in all of Japan. So you have the blue zone folks and you have those that are with the highest obesity rate because of the fast food that we're talking about earlier in the show that has come in and just ruined everything. But I love what you're saying here, and these are things that we can be involved with, and not just keep us long in life, but they give us life. We're engaged. People are around. I mean, you're smiling right now, and I'm smiling right now as we're talking about this. This is a life that gets to be engaged, fun, productive, contributory, and healthy all along the way, isn't it?
That's the point, right? Like, if there's not life in your years, what are the years
Yeah.
worth?
What are they worth? Yeah. I heard a guy say, you look on a tombstone and you say, here's the day you were born, here's the day you died, and your life is the dash. How are you living that dash? And is it vibrant? Is it live? Are you contributing? Is there something larger than yourself? Is there something you love to do that maybe is your own specialty you're particularly proud of? We're kind of turning a corner here and coming near the end of our show, but leave our listeners kind of with a final word of how you'd like them to think about your book, what you'd like them to get from it as they take a look at it, And just give us kind of a closing word, if you would, please.
Yeah, really what you just said, it brought me back to what has originally inspired me to do this work. We've talked about the problems with the medical system and the food system. Our world needs solutions right now,
Yeah.
and we're not going to find them without the wisdom and experience of our elders. We need
You
them
got it.
around and we need them engaged. And I think that we know how to do it. It's just a matter of spreading the word. Thank you for your help with that. And then getting the information into the hands of people who can put this information into action. And the change makers among us, and our elders, I see a vision where we work together to figure all of this out, to move humanity forward. And I hope that this book it moves us in that direction. Impact, again, is the goal. And I want people to feel empowered by the book, to feel like they have the information and the tools to put to work so that they can optimize their cognition and be part of that.
Really good. What a great vision. And that's an attainable vision. It's doable. And that's exciting. Well, hey, I would love our listeners to learn more about how to get in touch with you or how to learn more about you. And you got a great website, some great videos on there. And also how to get in touch with your book, Reversing Alzheimer's.
So drheathersandison.com. My last name is spelled Sandison. And you can get a copy of Reversing Alzheimer's wherever you buy books. It's available for pre-sale now and a hard copy will come to your door on June 11th.
Very good. Well, Heather, it's been fantastic to have you on the show. You're a wonderful guest. And thanks so much for all you're doing. And again, thanks for being here today.
Graham, thank you so much for having me.
I also want to thank you, our listeners, for dropping by and joining Heather and me today. It's always great to have you with us. Regarding our episode today, I want to remind you that it and its resources and all of our other episodes can be found on our webpage at triadhq.com/BHT. Thanks again for being with us on the show. And we'll look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.